World Mental Health Day is commemorated on October the 10th. The day aims to raise awareness on mental health issues as well as advocate against related social stigma. The South African Society of Psychiatrists is urging government and medical schemes to enhance mental health care for individuals with schizophrenia. The condition is characterized by episodes of psychosis, which include delusions, hallucinations, and disorganized behavior and incoherent communication. Let's take this conversation further with Dr Alicia Porter from the SA Society of Psychiatrists. Dr Porter, appreciate your time this afternoon. What are the main reasons behind the limited access to mental health care for individuals with schizophrenia in South Africa, and can these barriers be overcome?
So there are multiple limitations, Julian, in the sense that only 5% of the budget in terms of healthcare is used for mental health, and only a very small portion of that is used for community care. The bulk of the budget is used for hospitalization, and I think the difficulty is accessing care at community level and making, particularly in a private setting, funds available for outpatient care. And so I think that this can be rectified if we actually look at how our mental health budget is spent and actually look at focusing on community-based care and outpatient care rather than hospitalization.
So let's talk about the impact of schizophrenia on an individual's cognitive abilities and why early intervention is crucial in preserving cognitive function.
So, what we know is that there's definitely a decline in functioning. By the nature of schizophrenia, it's one of those disorders where it's chronic and it is characterized by, relapses and recurrence, and you have a decline in the overall functioning, including the person's ability to, cognitive functioning as well as occupational, social. So there's a downward drift with regards to their functioning. And so it becomes vitally important to actually detect this condition early so there can be early treatment and early management with the hope that, the progression is not then as fast as it would have been. Because people with schizophrenia, they have, in terms of their life expectancy, it's 10 to 20 years less than somebody without the disorder. And so it becomes vitally important to do the early screening, the early detection in the hope of better treatment outcomes.
So you speak of early detection. I suppose one would then need to look at the symptoms that would suggest that an individual might have schizophrenia. So what are the symptoms that people should look out for? Because I'd like to think that the late detection poses a problem, and it's primarily because people don't understand the severity of the condition.
Yes, with regards to early detection, there is a period before you get like the active symptoms when somebody is hallucinating or they have delusions, which are sort of beliefs, beliefs that people hold that are not true, but they're false, they're firm and they're fixed beliefs. And before the disorganized behavior and the disorganized speech, you get a period before the onset that we call a prodrome, where there is a decline in the level of functioning. There may be a decline in terms of mood symptoms. There may be, just somebody's attention to their personal hygiene becomes problematic. There's social withdrawal. There's amotivation. So it may look like an episode of like severe depression. And then there are features that may be suggestive that this is more than a depressive illness because of the severity of the functioning. And so it's about kind of looking at and being aware of these symptoms, especially if there is, for example, a family history of schizophrenia or other psychotic disorders. Then we need to be more aware and more on guard in terms of these red flags and not just dismiss it as merely, a bad mood or a bad day or they're going to snap out of it. It is something that needs to be taken very seriously.
So what role does stigma play in the absence of early identification of schizophrenia? I'd like to think that some people may not want to to call a spade because of the stigma associated with mental illness?
Yes, I mean, stigma plays a large role, not just stigma from, the outside and stigma from the communities and, stigma from a cultural perspective, but even self-stigma. It definitely limits access in the sense that people then don't present early. And we know when there is a long duration of untreated illness, be it mental illness, be it physical illness, the outcomes are much poorer in the long term, and in terms of functioning becomes even more impaired, in the long term. So stigma definitely causes a significant limitation in people seeking treatment. And as you say, just this difficulty in calling a spade a spade.
Now, how does the shortage of psychiatrists and psychologists in the public sector affect the quality of care for people with schizophrenia? I'd imagine that this is one of the challenges that you are facing.
So, I mean, the biggest challenge, I think there are shortages of psychiatrists across the board, both in the public and the private sector. I think there are now, the stats are sitting at there's less than 700 psychiatrists within the country. But, over and above the shortage, it's the way in which patients with schizophrenia are then treated, where with hospitalization, if you are in a private facility, you get 21 days of inpatient care, and then your mental health benefit is exhausted for the year. So there isn't then that outpatient treatment, which is quite important. And both in the state sector, not so much in the private sector, but even just a shortage or a lack of, injectable antipsychotic medications, which will improve, compliance and adherence to medication. There are those shortages and lack of availability, which then makes the condition or the circumstance even worse than what it currently is. And so the hospitalization is not necessarily the problem, because our health system is very hospice-centric. It's set up, for hospital care. But it's the community care and the outpatient care that I, believe will make the difference in terms of treating, severe mental illnesses like schizophrenia.
Now, as we wrap up, could you elaborate on the differences in treatment approaches between the public and private sectors in South Africa when it comes to dealing with the care for those with schizophrenia?
So, I mean, I think the approach is the same because we have guidelines, that govern how a condition is treated. But I think the difference comes in terms of the availability of, for example, medications, where in the state sector there is a limited number of medications that are available to treat schizophrenia, and there's a lot more availability within the private sector. Within the private sector, there are most medical aids which consider schizophrenia a prescribed minimum benefit. However, the allocation of funding within the private sector is, again, it's either 21 days as an inpatient or 15 outpatient sessions. That's not enough, to treat a chronic condition like schizophrenia. And most patients, medical aid is done by the time, 6 months of the year is in, and then it's done. Within the state sector, we have a, difficulty when it comes to beds, although I think it's the same in the private sector. There's a shortage of beds, there's a shortage of facilities. So there's an all-round lack of resources, and even the resources that we do have, there isn't an equal distribution in terms of hospital care and outpatient care. So it's one thing to get somebody well after 21 days in hospital, but then what do we do with them as an outpatient? Because we've got to keep them well. And I think that's where the call for action comes. We need to begin to strengthen our community services. We need to begin to strengthen our outpatient package of care and look towards more ambulatory, mental health care rather than just inpatient hospital care.
Dr. Alicia Porter, South African Society of Psychiatrists, appreciate your time. Thanks so much for speaking to us.